founders are highly at risk of burnout. In fact, 1 in 2 could suffer from burnout or other issues in their lifetime. And you know what? Guess what's the statistics for the average population in Singapore? Average statistics for population in Singapore is about 1 in 8. So for founders, it's 1 in 2. For the average population, it's 1 in 8. So we're actually 4 times more likely at risk. Now, the good news is that burnout is actually preventable, and there's more benefits in getting help than ignoring it. So first of all, we want to just acknowledge that, first of all, the struggles are very real. The struggles are very common. And more importantly, calling out to all founders and aspiring entrepreneurs, we are not alone with our struggles. So joining me today to share their startup stories are 2 fellow founders. First of all, we have Arun from Crely.ai and Julian from Jaga-Me. So hi, Arun and Julian.
Good morning, Keith. Morning,
Hi.
Julian. Good afternoon, rather.
Afternoon, Arun and Julian. Okay, so there's some things that I'd like to hear from the 2 founders. I mean, they have amassed lots of experience running their startups and managing their emotions, their own personal health. I'd like to hear from Arun first. Arun, thanks for your time. I understand you are the founder and the CEO of Crely.ai, an AI and wearables company to detect surgical site infections. Right? Can you tell us more about your work, your startup?
Yeah, I mean, thank you, Keith, and thanks to Catalyst, Dr. Reena, and everybody else on this panel as well. I mean, I think when you mention, Keith, is 1 in 2 people, especially the entrepreneurs, get a burnout. I think it's a very relevant and a timely topic as well. But let me start off with a quick intro. So Crely stands for credible, reliable, and early.
Okay.
So we are developing a medical device enabled remote monitoring platform to improve surgical outcomes.
Okay.
What we mean by improving outcomes is to detect and predict early exacerbation of surgical infection in patients after major surgery, and then work the sort of enable the clinicians to early intervention. So early intervention save lives. So that's what we do. So that's we are based in Singapore. We have offices in US and also in Australia. So that's what we do.
Okay.
Yeah, I mean, awesome. Yeah. So that's quick intro about Crely, who we are, what we do. Yeah.
Nice. Wow. Very good work that you're doing there. Intervention through AI. We need this kind of technology right now, actually. And what's keeping you busy recently, Arun?
So we've been really pushing hard to get evidence. And I think in our industry, especially medical devices, where it's important that through the lens of clinical, through the lens of regulatory, through the lens of technology, and also through the business and the markets. So we're managing, you're sort of looking at all the 4 dimensions. Any medtech startup has to really manage all these dimensions, and that's what keeping us busy. We are still early stage, just 2.5 years old. We've raised pre-seed capital. My main goal, and I live and breathe, is how to de-risk investment story and really get evidence and traction so we could progress to the next level of maturity. So that's where we are. I would call us, we're still in the proof of value stage. We've done the proof of concept, proofs of concept, and then we are moving clearly from how do we really make it beyond just a lab and an animal preclinical study. So I think that's what keeping me busy. Of course, COVID is not helping us with some of our plans, but we'll come to that. But yes, so we have a fantastic team in Singapore, and we are working on quite a few of these mini projects, conducting experiments to really de-risk our story. Yeah.
Understood. Well, thanks, Arun. I think there's a lot that my work at Bonfire could learn from you. We're also at the stage of developing the proof of concept and value. So let's catch up after this. Okay.
Sure, absolutely.
Now, thanks, Arun. So next, we have Julian from Jaga-Me. Jaga-Me is no stranger to the startup scene. It's been operating for about 5 years now. my understanding is that they are a mobile healthcare company that provides home care at your doorsteps. So Julian, thanks for your time. Could you tell us a bit more about Jaga-Me?
So when we started Jaga-Me as a startup 5 years ago, with including folks like Rina, my co-founder Ling Ling, and a number of others at a hackathon, we really wanted to plug the gap in post-hospital care. We recognize that often is the most difficult stage after a successful surgery, after successful rehab. How do you bring a patient back on their feet for the long haul when they get back home?
Right.
And in a country like Singapore, where and especially urban city centers in Asia, there are less and less helping hands on which you can rely on when, let's say, you're an elderly person, you're someone just recovering from cancer,
right,
or any kind of surgery. You have to kind of figure out how to make odds and ends meet in order to be well and cared for. I think in Singapore, we also have a very strong reliance on domestic help.
Yes.
I think whether that will change in the future, I think it's still up in the air.
Yeah.
But I think what Jaga-Me is trying to create is a networked and caring, community of healthcare professionals that can easily reach out to people at home or in the workplace in order to help deliver an alternative to being in the hospital or in institution for a longer time. So that's a little bit about how we started, why we do what we do. And I'm very happy to be part of this conversation, to learn from you guys and about how you guys cope, how you guys think about mental health amongst founders. I think it's a very relevant topic, not talked about enough, and particularly in the healthcare industry, which can be very difficult, challenging in numerous ways, like what Arun mentioned, clinical trials, for example. I can't underestimate how you guys do what you do day to day, and I'm very glad to contribute in any way.
Right, thanks, Julian. I think we are all doing our best to achieve better health outcomes. I think like what Julian, you mentioned, since your days getting to know the team through the hackathon to right now, building and enabling your customers to have maintain the quality of care post discharge. I mean, all these are very important work, and we see that there's a lot of advantage, the technology, empathy, hard work that really goes into making this successful. I think with all this work that's done, I think there's bound to be a lot of pressure, stresses that really falls on the founders. And I think Julie mentioned previously, we're often the front line and also the last line of our work. So I think that's a lot that we have to do on a continuous basis. Now, I think one thing that I'm personally very interested to know is about how you guys do it. Now, I heard that as much as 90% of startups fail in the first year, but obviously both your startups overcame that. I mean, Crely.ai has been running for about 2.5 years with a very solid team. I read the profile, very solid team. Now, Julian, your company has been running for about 5 years. I'll maybe hear from you, Julian, first. How did Jaga-Me overcome the first few years where it was so critical for survival?
I think it's I'm very happy to share. I think Keith, thanks for raising that. Every startup has a unique journey, right? And by no means can I prescribe. So just a disclaimer here. But I think if I think back of what are some of the factors, I think one very important part is really the people that you work with, the team. My team, the team that came together with to build this company, Jaga-Me, are some of the most dedicated, intelligent, thoughtful people that have come together, from everyone helping on, the clinical side, the technology side. People who are willing to stake it out and go all out for that hope that will make patient care better after the hospital. I think that really made the biggest difference in terms of the company's ultimate journey. Um, but at the same time, I think not to discount also the advisors that come in, people like Jeremy, Lim, who helped us along the way.
Right.
Investors who definitely voted with their wallets. Those are things that would have been invaluable, and a lot of the mentors coming along the way. I think that these are the human elements. Yeah, we can talk about networks, capital. These are all ingredients, but I think at the core of it, a company is ultimately it's not just bits and bytes, it's people. And I think if you want to build a long-lasting company, I think we have to recognize the role of people, and I think that's where I would put the emphasis for our company as well.
I couldn't agree more, Julian. Oh, thanks so much for acknowledging that. The people element, hiring the right people, the right team, to go through this journey together. I think that is one of the key main ingredients of success. And also want to call out that entrepreneurship, I think as we all have seen by now, it can be very lonely sometimes. So having the right people to walk with us through this journey, having that social connections is so important. And I couldn't emphasize more about social connections being one of the key ingredients to mental wellness. Because entrepreneurship is so hard. Some alone, having the right connections. I'm talking about teams, family members, friends, advisors, like I said, investors who are there with you to go through that whole journey is so important. We should not walk alone. Now, on this topic about overcoming the earlier years, I want to hear from Arun as well. How did Crely.ai overcome the first few years, first 1 or 2 years to come to where you are today?
No, I think it's a great question in the sense it's a very sobering thought, like 9 out of 10 startups fail in the first year. So I think if you really look at the reasons why companies fail is their unmet need. I think entrepreneurs exist to sort of unmet need.
Yeah.
And again, it all starts with great idea, and then an entrepreneur is really good at spotting that unmet need and then really going very focused on that. So again, so if I recall the first year, so I have a co-founder, a medical doctor in the US. So again, good friends, he's an orthopedic surgeon.
Sure.
So we started with just 2 people, and I was in Singapore. I was shuttling back and forth between the US. So I traveled quite a bit, went to almost every conference, and we didn't hire any full-time people back then. So I spoke to about 125 plus key opinion leaders in multiple countries. So the first year was really spent in knowing, sharpening, fine-tuning what is a problem that we are trying to address. How big is the problem? Is it worth spending the money? Would we get paid? Because entrepreneurs also need, their focus is to fill in a gap, right? And also successfully getting the economic value out of the gap. So I would present at anybody who's asked me to present, meet with this. So very first thing, talking to the clinicians, key opinion leaders, it was very challenging up front. You have an idea, you want to talk about it. My biggest success came about 9 months into my startup journey. So one of the clinicians gave me about 2 minutes, very busy. So I somehow finagled 2 minutes with him, and I started talking about it. He's a vascular surgeon. He ended up talking to me for about 30 minutes, and end of it, he gave me his business card and said his personal cell phone number, anytime you call me. So I still tell the same story. I've told it many times to my team. So that was my first success. So in the sense, you got to be optimistic. The first years are very difficult. There's a cloud, it's not a fog of war, but it's just ambiguity. So you're dealing with all things. I was also a mature founder. So I was not some fresh from college. So I was formerly the group CIO at Stryker. So I had that's given me some of the network access to people and technology. But I think I was fortunate. But 3 things, if I have to say, how did we cope? meet with a lot of people, talk to a lot of people. And I think the social element is more important. Some people may be doing coding or development at their cave, but I didn't do this way. I really traveled quite a bit. I met with a lot of people. And then, optimistic outlook, I think, learn a lot. And I learned to read scientific publications that I've never done. Learning is very important, early stage. And Julian acknowledged the value, of course, both of you, social, family. So I had a very, very supportive family in the first, still supportive. But that is really one of the key factors behind coping. If my family had given up to say, like, you know what, I don't really care what you do, I can't, there was always compromises. Like, we didn't have the same standard of living, quality of life. Not a huge compromise, but this is a factor. Coping with expectations from everyone. So your family, your friends. So I think, so I would say it's still early stages yet for us, but I think we have managed to build up resilience, not only with myself, but also the team. So I think that's the key takeaways. I would say, talk to a lot of people, don't be alone, build a network, build your education knowledge, and also acknowledge and be grateful for the family support or whatever. I mean, if it's not a family, if it's some kind of a social mentor network support. Yeah.
Well, thanks, Arun. It's a beautiful story, beautiful journey that you had. I think this is personally very inspirational because we are like at year one. To be very honest, we are currently is at year one of what you were experiencing in year one. We're currently talking to a lot of prospects and customers. Hounding them on LinkedIn, getting a lot of referrals, just to make sure that we understand our customers a lot better and validating our solutions. And you mentioned a very good point about why startups fail. I think the common reason is that they're building something that the market don't need or the customers don't need. This is a very strong pain point. And really to overcome that, like what you did in the first year, to go talk to your customers, go fly around, get all those meetings. And this perseverance, the second factor, hard work, perseverance, commitment, it paid off. At that 9th month, you mentioned that clinician gave you the main part. 5 minutes became 30 minutes. Amazing story. And then, of course, you also took the honors to learn more about the clinical knowledge terms. And then eventually having supportive family, again, falling back to social connections, family members, teams are willing to stick by with you, make small compromises along the way, and make it through the chasm. Very inspirational. I learned a lot as well, just from these two questions. Thank you so much. Now, I have so much questions, and in fact, I want to really learn from you, the both of you. It seems that one thing that's common is that hard work is required. Like building the network of Jaga pros for Julian, ensuring there's continual care, the quality of care, hiring Singaporeans, good quality caregivers. All this is hard work. Finding the right clinicians to talk to the customers, building the proof of value. All this is hard work. There's tremendous amount of hard work to be done in the first few years to survive and thrive. And I'm sure that, with all this hard work comes successes. But of course, the successes comes with struggles. Behind all the struggles, behind all the successes are struggles that maybe prior to today, we don't see and talk often. I can imagine that the amount of stress from the struggles will be tremendous during those 1 or 2 years, or even till now. So I'd love to hear maybe from Julian, from your personal story. Could you share with us your most difficult moment during those early years?
Yeah, I think that's a great question, and I want to maybe just put it out there that the intent of this sharing session is really not to sugarcoat it, because there are definitely people out there who might be tuning in, or perhaps maybe relaying to your friends that who would not have had it much more difficult than I, or even any of us. And I think the questions there is maybe could there be some nuggets that we could share, because a lot of things are very contextual. Like, for example, some families might be very supportive. Some families might be extremely pressed, to do something more practical, so to speak, practical. So I by no means want to, I want to acknowledge that. But for me, I think one of the big challenges was in the early days managing also, the fact that startups are a huge commitment. They're really, I would say it's equivalent. You guys have children. I think I think it's, if you guys say it's much more credible than I. But having a startup is really like having a baby, and it's a non-stop kind of a commitment. Arun is laughing. I think he has a lot more experience. So, I think one of the challenges then is that a lot of things that are important uh, become, the tensions. For example, you have family, right? Family is important. Everyone says it's, and I think it's deniable that we should value that time, the amount of self care that you have. But when your startup is in a point whereby you're all hands on deck.
Yes.
For example, I think one instance that comes to mind is that fundraising is always a time where you're all hands on deck.
Yes.
And as a founder, you're not only doing fundraising, you're working with your team to run the show, and continue to grow the company. You're listening to the problems of your employees, and at the same time, you have to you have your family commitments. I think that was a challenge for me when I was when I was engaged and about to get married. I think that was a big problem because you have all that stuff you need there, you think through the plans, but I think it was a huge test for me because I was almost like an absent groom, not in the sense of emotional standpoint, but rather from a you're there thinking through the plans, but you're not really there. You're kind of toggling you in your mind. Maybe the limitations of my mind. You have to figure out how to alternate path between these different things, and it can be challenging. I think that was a really tough point for me because while you're getting married, while planning to get married, you're doing fundraising. It's a thing to do. I think that was one of the toughest things I had to do. Suffice to say that sometimes things gotta give. It's some people, some stories come out whereby you've got your cake and you can eat it as well. But in my case, I actually had to postpone the wedding. Things didn't work out as well as we had. It was difficult. I mean, no two ways about it. And sometimes, sometimes other people pay the sacrifice, not just you.
Yes.
I think that's something I learned, right? And frankly speaking, these experiences are things whereby you only can reflect on and try to find a way to divide that line a little clearer, make the priorities a little clearer, more defined, and try to make it up to the people, the people who help you on the way. I think my wife now wife is super supportive, even though I have this company. I run a company that takes up so much of my time, and I think even though it was a challenging point, right, where you had to kind of, it's me or the company at that point in time. In a sense, it's not exactly that perspective, but founders do have to make these decisions sometimes. And I think having overcome that, you become stronger as a family, you become stronger as a member of the team. So I think these are that's one particular experience for me.
Well, thanks for sharing that, Julian. Very heartfelt words, and I can wholeheartedly empathize and relate to your experience. In 2017, I mentioned I experienced my first burnout, 2017 was also the year I got married. I didn't postpone the wedding. I just bit through, bite the bullet, and I said, I can handle this. So I can totally understand how you feel. I didn't postpone actually, but I wish I had actually. Because getting married, all the planning, moving in a new house, and making sure that the company actually survives, the employees are actually engaged, funding is actually raised, problems are actually solved. That's so difficult. And that was why in that year I burned out. It was overwhelming to manage my wife, the wedding, the company. So I totally know how you feel. And I think, like I said, drawing some boundaries, knowing when to push back. I think those are very critical lessons that I wish, back then, 2017, someone had told me how to manage that. And sometimes think about, yeah, maybe I could just postpone it for one more year. It doesn't hurt. So very inspiring to hear this. Julian, we should really catch up for beer someday on this. And yeah, so I always want to hear about maybe from Arun's point of view. So I'm sure you have a fair share of stories as well. And I'd love to hear about, in those 2.5 years, what was the most difficult moment or your lowest point during those times?
Yeah, and in fact, really great to hear this. You guys manage your personal, transition, like, with the marriage and all this. This is really kind of a once in a lifetime event for most people, I would at least would say. So Todd actually has posted a question. So I don't know if you want to take this. And he said, he asked a question, who did you reach out to when things got difficult mentally, right? A therapist, a friend, or a colleague? He also goes on and said, as a founder, wasn't it important to show strength to others in the startup? So I think it's a very good question, and I want to blend it with my low point. I think in the sense, all of us know startup is not a straight linear curve. It's like most of us go through the valley of death. We really go through a low point where I said, like, not with everybody, but some people say, like, why did I get into this venture? I mean, things come to, these things are normal. So our low point in our journey, the last 2.5 years. So as I mentioned earlier, evidence is very important in our line of work. I mean, essentially, it's true in every business, but I think if you're reaching to clinicians to say, look, hey, my solution can do things better, blah, blah, blah. Okay, I give you this, but show me how. I mean, from everybody, including regulators to clinicians, ask for evidence. So we completed our first preclinical animal study in Singapore in 2019. So that took about 6 months of planning and execution. So we met with US FDA, we understood their regulatory framework. So we started preparing for a preclinical human study 6 to 8 months. So a lot of preparation goes into it. So which means you're betting everything. You're sort of hiring people, raising capital, seed money, pre-seed money, sharpening technology, lots of things you do to get the data, to get that evidence, right?
Get that data.
So not to mention the IRB approvals, if you want to, it's a whole set of things that need to be done, and everything takes longer. If anything you work with, including patients, you've got to put a device on a patient. So we started our preparations from June, July 2019 for a clinical study later in 2019. So, it took 6 months of preparation. We finally got the approval in January 2020. We started our first patient preclinical study February 2020, okay, about a few months ago. We collected data from 3 patients, and COVID-19 stopped everything.
Nice.
Okay. So this was the low point. I mean, look, so think about it. All the work that we've done for a year came to a stop. Okay. And this was a crucial point because we couldn't proceed further without having the data. It's a chicken and egg, and by then we had built the team. The team was all prepped. So I think I'll with time. So I'll probably answer this question. How did I personally? Again, I want to relate to this question. Yes, it was very difficult. Again, I reached out to a friend. You need a sounding board in times like this. So sounding board at different levels. So like sounding board, somebody who would like to have a beer with and say, like, hey, you know what? Hey, I'm doing this. What do you think? What am I doing right? What am I not doing right? Right? I needed a professional input. So should we reduce the sample size? So you need to talk to people at multiple levels or for multiple things. So asking what if questions. How do you really do this? How do you come out of this? Right? So when the circuit breaker kicked in March, everything came to a standstill. Yeah, which means nothing could be done. I didn't feel the need for a therapist to answer to Todd directly, but a coach. A coach. So kind of an executive coach. So now I've been thinking about having some coaching. It's I was early stage to say like, hey, frugal, should I pay for a coach? And coaches are, they give the good quality time and advice, but I thought I could do it myself. I could coach myself, but then I realized, look, am I thinking like a leader who's going to take this team and company forward, not just hunker down and stop everything, and then in the kind of a mindset like, I've got a crisis and I need to shrink everything to a stop. So I think I needed help, and I reached out to a coach and to talk through. And I think it is, and I would, if you can afford it, if you feel the need for a non-judgmental sounding board, and I think every founder, either you have a buddy who you can talk anything about your business to say like, hey, I don't like my blah blah blah, this is not good, someone to vent the frustration, right? I mean, so it's important to have someone you can trust innately, right? Because you're going to talk some innermost feelings, right? Spouses are not the best ones, so they can give you this, but I don't want to the great support, but sometimes you need that the trusted advisor, a friend, or a sounding board, where you can really talk your mind and say, look, hey, how do I really address this? And I think most of us will eventually figure out, because but I think there is this need for a space to talk it out. That's what I can relate from my own direct experience. So another one to Todd's question, yes, it was important to show strength in a startup, but also what we did, took a core team, we sat down in a 2.5 hour Zoom session, really had talked it out, and I did show our vulnerability. Look, guys, this is what it is. So I wasn't showing off to say like, you know what, screw it, if it's not there, we'll find something else. Say, look, this is a problem. So acknowledging a problem.
Acknowledging a problem.
So now I thought one of the things we did really well was to keep the core team small, but also we have everyone has each other's back, in the sense it's a fairly close-knit team. They know what my challenges are, and I know what their expectations are. So talking about it, it's a great question, Todd, but yes. So to even summarize it, all of us need a sounding board. Whoever works for you, so whether your spouse or a colleague or a friend, but I think the characteristics of this would have to be non-judgmental
Non-judgmental.
and listening. The person, like, you don't go for advice to say, like, do this, do that, or you didn't do this. So I don't think the founders need criticism for their actions, but someone, at least I can speak from my own experience, someone who can listen and really help me to figure out. That's the missing. So I've been a mentor to students from NTU and also from Singapore Poly. So I think I've been doing it for quite some time, on an average about 6 or 7 students per year. Wow. So that actually helped me to say, like, what are they going, when I listen to their challenges, to say, like, I need help too, acknowledging that. So let me stop here, but I think it's a great question, Todd, and you probably triggered a little bit of a longer answer. My apologies if it took too long, Keith.
No, not. In fact, I wish that the both of you would expand a lot more, elaborate a lot more on your thoughts. It's a very good point, Arun. I think that having a mentor, a non-judgmental voice and an ear is so important. And how is it going on right now with the coaching and advice? Do you manage to find a solution? Or?
Yes, so it's very interesting. I've had a couple of sessions with my coach. So again, he's also very supportive. He doesn't impose, like, you have to really meet with me every week or so. I think it's really, we talk about some of the challenges, what my gaps were, or what do I need.
Okay.
And one of the, again, I can share it, one of the key points which I'm practicing is to say, write it down.
Write it down.
So it seems like a mundane advice to say, like, what is this? I mean, I tend to keep lots of things in head, and then that's where my memory and processing happens. And you say, like, write everything down. That's a very simple but a good advice. And I would say, that's a good takeaway. So I would say, and it can change, it will change, but write it down. State your goals. So having clarity on the goal, it's a little bit of an exploration to say, like, what do you really want to accomplish, break it down, but also writing it down makes a commitment. I found that one piece of coaching really helped me. Yeah.
Thanks for sharing. That's very valuable. On Todd's question, I thought I would like to maybe hear Julian's point of view again. So back to the time, that difficult moment during your marriage and building Jaga-Me. I just want to hear from you. During those times, do you manage to find someone that you can actually talk to and get advice? I mean, other than your fiance, of course.
I think it's a good question. I think there are two parts to your question. One of it is, who do I turn to? Second one is, I think more towards Todd's question about, I would like to address about his question about showing strength to the team in the startup. I'll break it into two parts. I think for me, first, this is quite unique to at least to my own journey. I think people that came around us in our lives at that point very much were, family friends, people from our, dear friends from our church, for example, who came alongside to counsel or to even talk things through. Those were very important. I think the people in our lives who came alongside us was so important. I think having having received their help, I'm so grateful. And even the people on my team as well, offered their support. I think they a lot of the time, the team members see, they read the actions and the words of the founders. And when they see that you guys are, you're going all out, you're putting out for the company, they not only mirror that in their own day-to-day, but they also have empathy, right, for whatever you're going through. So I think that dovetails with what Todd's question was. Firstly, I think there's in my opinion, it's not constructive to create a persona that is not accurate to who you really are, right? I think it's good to be genuine in terms of
Yes.
presenting the struggles, because that facilitates that's reciprocal, candidness, that candor from your team as well.
Right.
Because you don't want your team, for example, to be saying, "Oh, it's good, we are good," and then
No. Yeah.
in a week he's going to tender on you, and
Yeah.
you couldn't see the better, right? So I think having transparency and candor would be a much preferred way than creating a persona where oh, I'm untouchable. I'm more untouchable than Steve Jobs, Elon Musk, and whoever else you want to add into the fray combined
Yeah.
together. It's like
Yeah.
that's not realistic.
It's not realistic.
On that note, I mean, and I see this also not in a pedantic way, but rather I think it helps create unity. When people see you struggle, they struggle together with you, creates unity, especially most importantly in the founding,
Exactly.
but also with your core team members. I think that's important as well. Not to show that, not showing your struggles or your weaknesses, not communicating that, can be a loss of that opportunity to draw together as a team. So these are just
Exactly.
2 points on showing strength. Obviously, you don't want to you want to be frivolous. I think that's the other end of it. Like, oh, I complain about the traffic. I complain about this. There's
Yeah.
a certain limit to that, but I think having a real, realistically sharing where you are now and how you feel your struggles, it does help. Yeah.
Wow. Thanks so much, Julian. And Arun, very heartfelt words again, very honest, very authentic answers from what you guys went through and how you guys are coping. From what I see, there's some consistency in terms of what you guys went through and what was required to actually support you during those difficult times. I think, first of all, especially when you need to talk to someone, it's better to find someone who's non-judgmental, someone who can work with you, to actually listen to your thoughts, listen to your pain points, and walk through with you. And like, it goes back to that important thing about the core team, right? These are the people in the company who's most likely going to stick through the thicks and thins with you, and keeping it small, keeping it very genuine, helping them to understand what's really happening, being very transparent about the challenges, and then at the same time creating unity. This is really true. Difficult times that you see people who are really there with you, who are willing to work through this with you. That's so important. And truly, this is really inspiring for me. And I think as I build my team later on, I'm be very sure to bear this in mind. What to look out for. And then the next thing is about COVID-19. So, Arun, I understand that this COVID-19 times have put a stop to those clinical trials. On the professional side, you have gotten support from a coach. On a personal level, how are you coping with this newfound stress of COVID-19?
Yeah, absolutely. I think so. When we were very social in the team, when the circuit breakers sort of hit, like, say like from very active meeting every day, and then suddenly all social activity stopped. That was I'm always on Zoom in the sense, so it's like fairly easy. But I started to run again. So I used to run, and then I sort of gave it up because of travel. So I think getting that personal time, personal space and time. I mean, I guess all of us work. I mean, so this work from home or a virtual thing is not working less, but I think work fills up the gap. I think all of us end up working more long hours from home. So I fairly early realized that I need to get out. So I put time in my calendar, literally, to say, look, 2 hours of personal time every day. Right. And I don't let anybody touch those 2 hours of time. So, which is I go run and do some workout. So that at least, has helped me to give me that space and time to think through, reflect. Some days I run faster to just get rid of the stress. Some days I run slow just because I could use the time to think, use the time. And more often than not, actually, when I come back after a run, some of my problems, find a solution while I'm running. So I think
Nice.
that worked for me and works for me continuously. So again, I'm very grateful for that. Second, I think Julian mentioned, and you also mentioned, Keith, grateful. That is a word and that's a feeling that, you know, it's you have to feel it in the sense. When I looked at all of the happenings with COVID-19, we are very blessed. At least we have the immediate needs are taken care of, things are working. But there are millions of people whose basic life and existence has been put at risk due to COVID. Compared to this, our struggles, at least I can speak for my struggles, my company struggles are nothing. So I think that there's a really feeling of being grateful to say, look, we've still got a fantastic team. We still have, money in the bank that we could really use it carefully. So we don't have to really look at, hey, am I really going to go run out of cash and stop, paying people? So we've been fairly frugal. So that is sort of there. And we also espouse peace of mind as one of our core values. So I think we have peace of mind. So that feeling of being grateful about all things we have today is, and I can't overemphasize that feeling of being grateful for all the things we have, in spite of all the 8-9 months of effort sort of wasted. Not, I wouldn't call wasted, it's suspended, not have any clear signs of starting again. And third thing is optimism. And I think I'm an eternal optimist and I would never give up. And I think it's not sugarcoating and then being in denial, but I think optimism, when you wake up every morning, there is something you can do. And I really mean it. I think those things are the personal things that has kept me moving, physically getting fit, getting better, eating right. I mean, these are mundane things. I mean, all the things we know about, these are not exotic things. Sleeping right, eating right, working out, feeling grateful, and also, I would say feeling optimistic. So that's personal coping. On the professional side, I think we've done well. So we've sort of found a way to repurpose some of our sensors to detect early signs of deterioration in COVID-19 patients, especially in viral pneumonia. And Dr. Reena, who's on this call, she's been of good help as well. So I think we're not there yet. So we are doing a proof of concept for the second use case. In a perverse way, we have more patients that we can actually use to collect data from a COVID-like symptoms, though our surgical use case is a little bit behind schedule. So I think I would say, for any aspiring or anybody who's a founder going through this journey, I think this too shall pass. I think this too shall, COVID-19 will also pass. I mean, it will have its damage, whatever damage it does. I don't think it should damage our spirit. That's what I think I would say. Yeah.
Thank you, Arun. Very inspiring. I would love to, Arun, thanks a lot. It's very inspiring. I also love to hear from Julian as well. With COVID-19 times, how are you also coping with this newfound stress, this black swan?
I think the two, I think for us, it's a bit interesting given that when the lockdown happened, we were very quickly approved as an essential service provider. So
nice.
to a certain extent, things we still continued very much our operating work. In fact, it stepped up quite significantly in terms of us being able to help many different fronts, where whether it was helping to ramp up a swab facility very quickly, or helping create mobile roaming teams that were able to support elderly persons in nursing homes, support migrant worker dorms. These were avenues whereby we could, we were put to the test, and we had to rise to that challenge very quickly. So I think ours is a pretty peculiar scenario relative to a lot of the medtech startups, because we are a little bit in between tech platform and also a provider itself. So I think for us, we had to manage the pressure tension of, on one hand, being very operational. Had the opportunity to be on the ground with my teams, who are all gowned up, facing eye to eye to COVID patients. Myself, so even as a non-clinical person, I think it's something that I helped me empathize very well with the patients and the clinicians who are on the ground. But on the other hand, we still need to balance all the other stuff we're doing, right? The development work, the coding, the rest of the what runs our business as a platform. So I think it's one of the times whereby we are faced with a end situation rather than or. So I think that's where how we have to some of the changes we have to ride during this time.
Right. And how are you personally, as a individual, coping with all this positive stress?
I think it's definitely I've dealt with it. I think so far it's been very positive. There are definitely times when you feel tired physically, because you have. I mean, due to the very dynamic needs that the community, that the country is experiencing, you have to kind of adapt very quickly.
Yes.
So I think that the line for personal time and work has been further eroded.
Yeah, it is.
I think it's just, but I mean the fact that I'm calling in from my home is actually miles better than many people who are working on the doctors and nurses and care professionals who have to be on site every day, running around. So I do feel grateful that for what they do and what my team has been putting up with. It's really challenging stuff. I mean, just to build on the physical aspect. When you're on in full PPE, and you're in an environment outdoors. I'm not kidding. I mean, your surgical gloves fill up with perspiration, and that is something that you can't imagine. I mean, for me, not being a clinical person, I really take my hat off again and again to my guys who are and our partners who are doing this on a daily basis.
Understood.
It's I think for me, when I think about my own fatigue, I think about my guys, and I was like, okay, I think they have it much more difficult, and I think that's where I want to make sure that we become more of enablers for the people that we work for and with, rather than being the bottleneck. So that's what we try.
Understood. So similar to Arun, the sense of gratitude is very important to keep our emotional levels healthy. On the personal time, Julian, do you actually manage to find some time to go out, like say, to nature, things like that?
Yeah, kind of. No. Short answer is no. I think now personal time maybe it's like you going on grocery runs. So I guess we just have to adapt in that sense.
Okay, understood. I can imagine how much work you have to do, especially now with more support required from your company to assist the government and COVID-19 patients. So kudos to your team. Thank you. Thank you, Julian. Now, I just want to check if there are any other further questions from the other participants. Okay, good. I think we've answered Todd's question. Thanks so much for asking those two questions. Very poignant. Appreciate it. Now, I think we have about 3 minutes left. Of course, there's so much things I definitely want to learn about from Julian and Arun. I'm happy to take it maybe offline. But of course, the Q&As don't end here. If you have more questions after this call, please feel free to post on our LinkedIn thread, the LinkedIn post that we have shared about this webinar. Feel free to email us as well if you have more questions. We want to keep this conversation going. Find us on LinkedIn, email us. We'd love to hear from you. Now, I think in terms of wrapping up this 1 hour, I personally wish that someone had shared with me, warned me about founders burnout and how to manage all these stresses back in 2017. And I learned so much from Arun and Julian today. And I hope, I sincerely wish that you have picked up a key lesson or two from today's webinar about the journeys of being, the hardships of being an entrepreneur, and that you learn something about how to thrive during these difficult times. Now, we have a part 2 to this webinar series, where in the next session, we'll invite 2 certified mental health care professionals. The first is Dr. Tina Tan from IMH and Jennifer Davis from Duke NUS Medical School to our panel and hear the expert advice on what happened.
I think we may have some signal issues with Keith.
Okay, it's okay, I'll take over. I think Keith is having some signal issues. So hi everyone, I'm Felice, I'm the community manager. So basically we have the second episode of the webinar series, where we'll invite certified health professionals. So Dr. Tina Tan, she's a consultant psychiatrist at Institute of Mental Health. Then we also have
Tuesday on
Jennifer.
24
Keith is back online with us. No worries about that. It's always technology, but whatever it is, Keith, I'll take this over. So we also have Jennifer Davis. So Jennifer is she's a certified psychotherapist as well. On top of that, she's the appointed director for the student affairs, handling the medical students over at Duke NUS Medical School. So of course, we also have Keith again, who is the moderator for the next episode. So do join us next week. So the mental health professionals, they will be looking more specifically on how what's the definition of burnout, what's the definition of stigma, what are the true approaches that you can do in order to tackle such issue, especially during this new normal. So do join us for the next episode. We'll send you the details as well. If not, we see you next Tuesday online at 12 p.m. Thank you, everyone. Thank you so much, Keith. Thank you so much, Julian. And thank you so much, Arun.
Furnace, I think just one matter. There's 2 open questions from Anna
Yeah,
and Alice.
I know.
So here
Let's
is
answer that.
Yeah. I think what we can actually do is I just wanted to close this logically. I don't want to leave it hanging. Keith, you wanna take this?
Yeah, sure, definitely. Keith, shall I just maybe help to address the question? So first, I think Anna, you posted a really good one. We definitely see so many young millennials, even myself included, wanting to have my own company, my own startup. But we know it's not easy, and that's where we need to hear the true experience from. Maybe Arun, yourself, let's start from you. What is that one word for them? Let's keep it short and sweet so that everybody get the gist of it.
Go for it, but read the book The Founder's Dilemma by Noam Wasserman. I think you need to get clarity on why you are in this entrepreneurial journey, but go for it. I would encourage millennials.
Okay, then Julian, what about yourself? What's your take on it? I mean, you yourself is also pretty you started your company pretty young as well, but I've definitely seen immense growth in it. So what is your one true word that you want to have for them?
I guess I'm an old millennial.
I'm a non-millennial, okay.
Okay, just one last question from Elise. Is there a community out there that you encourage startups to join to get the mental wellness or emotional support? Is there a community out there that what do you guys think? Like, I mean, we've definitely seen a lot of applications as well. In terms of using technologies, advanced technology to create such tools. What what do you think is the best avenue out there that could probably encourage startups to get into this mental wellness support? Maybe Keith, let's start off with you since you actually created.
Sure. Right, I'll be happy to take that. So is there a community right now? There are plenty of communities. The thing is, it's quite fragmented, and I'll be happy to share this maybe after this call with everyone. There are a lot of ground initiatives, very fragmented, a lot of efforts. So where I see centralization, unification can happen is at a company level, because we spend a lot of time at our work with our employees, our teams. Bonfire is created to actually create support groups among companies. That's one of the core things that we do. So we feel that if we can actually build these communities from within our office, where we spend a lot of time with, that would be probably more effective than trying to join very offline events that's pretty sporadic and very fragmented out there. So that's my very short answer. Yep.
Yeah.
Okay.
What about Julian yourself? What's your think? I mean, definitely, you are Singaporean yourself. You see us overworking, and then having startups. You yourself as a founder, what do you think you could help to promote within even to your own employees?
I think there isn't a one size fits all community in this regard. I think people have to uh, uh, ask around, talk to a friend, talk to a family member, a colleague, and try to hone in on what are safe places to have these conversations and to have this support. I think the bigger, rather than a community, I think the bigger barrier would be just perhaps inertia or fear of talking about your struggle. I think that one is the bigger the bigger limitation, because I think I felt that the same way as well, and I was surprised how many people were willing to help and to listen, even though there was nothing I could really offer them. Right? There sometimes are not any custom made communities, but I think the important part is relationships with people, and having them support you, even just based on their goodwill, their charitableness, if I mean. I think that's where a community starts from.
Okay, thank you, Julian. Okay, I know Arun, you are dying to answer this burning question. And so of course, you as a boss, like, what kind of thing will you do? Maybe even creating a welfare task force. I'm not very sure. I'm just very, very open and wanting to learn from you guys as well.
I want to be mindful of the time as well, Funny. So, look, I think this is a conversation that has to continue, but it's a great point. I don't have an offhand answer, but I think this is an unmet need, and hopefully somebody will help. But I think I would have to be very honest. I don't know of any community offhand that could provide the support network. Places like Catalyst are a great meeting point to network and talk about it. But I think it's a good starting point. I think we should maybe Catalyst can really have a mixer where we can, it needs to build the trust. I think I wouldn't go and talk to a stranger and talk about all the challenges, but I think Catalyst is a great place to start.
Okay.
With that, I have to really leave. I've got a back-to-back appointment. I appreciate everyone, and I apologize for just leaving a little bit cut.
Yeah. Okay. Once again, thank you, everyone. These questions we'll take it offline as well, so we can address them word by word. So with that, I'll see you next Tuesday, 12 p.m. here online as well. Thank you, everyone. Goodbye.
Right.